Hi there, it's Suzanne McLean. I'm going to show you kind of the steps, exactly how you're going to go out to the Medicare website and compare your current plan to any other plan for next year, for 2024. And then I'm going to go over the mistakes that I see people make while they're reviewing their plan. So you're going to go to Medicare.gov. This is a government website. So once you type in Medicare.gov, then you're going to go here and you're going to click on Preview 2024 Plans. And that's where you can go in and start looking at your options. Now, if you have an account, you can use your account, but what we typically do is just go over here where it says Continue without logging in. So we're going to look under 2024 Plans, and then you're going to put in your zip code. Now, this is the zip code where you reside. So if you're a snowbird, where you're in a different state, make sure you put the county that you actually reside in, that's on your taxes, where you're a legal resident. So 43213, the Columbus area. Oops, 43213. And then you're going to just hit continue. Okay, so now what it's asking you is, what do you want to review? Do you want to review Medicare Advantage, Medicare prescription drugs, or Medigap? In this case, we're going to specifically talk about the Medicare prescription drugs. This is a standalone drug plan that most of you have purchased with your supplemental insurance. So typically you have two separate plans, your Medicare Supplement and a prescription. So this is just for your prescription drugs. Go down here and click Find Plan. Okay, so the question comes up, it says, help with your costs. Now, some people, depending on their situation financially, they may get assistance through like state Medicaid or extra help. Now, if you don't get any of those assistance, you just put, I do not get assistance from any of these programs. So you're going to click that and then click Next. So when it comes up and says, tell us your search preference, do you want to see the drug costs? The answer is absolutely yes, you want to see that. And then click that. All right. Now here's where you're going to go in and you're going to start looking at your prescription drugs, typing them in. Now here's where it's so important to go directly off what's on your bottles or what's on the actual prescription. Because let's say that you type in a capsule. So you type in a specific drug and it's a capsule. You put capsule, but you're really taking the tablet. It can be completely different. So let's just start with, let's just do like a atorvastatin. Okay, so a lot of clients right here on atorvastatin. So you just start typing out the name. It gives you this drop down. You're going to click on it and you're going to add the drug. Now here's where it's asking the dosage. Very important we have the dosage right. So see, you have a 10 milligram, a 20 milligram, a 40, and an 80. You have to make sure you have the right one selected. So let's just say you want the 40 milligram. How many do you take? Let's just say in this case, you're doing 1 per day. So you need 30 every month. We want to add to the drug list. Okay, so you're going to add it. Now we got to go up and do another drug. So here's a big one that I'm seeing this year on the formularies is the drug Symbicort. That is an inhaler. And that is an inhaler for people that either have asthma or like COPD. So let's say we add Symbicort. Let's add the drug. Now it pops up and says there is a generic available and it may cost less. Do you want to add the generic or keep the brand? Now in this particular situation, we're going to keep the brand. Now, if you're taking a generic and like this would happen, you would change it to generic. But this particular situation, we're using the brand because most people are still on the brand name. So we're going to go with keep the brand. Okay. Now here's where it gets really tricky because the dosage, you see how there's 3 different, let's say two different types. You have your 80-4.5 and you have your 160-4.5. Let's just go with the 80. But then the package, we got to make sure we have the right package size. Let's say that we do one inhaler every month, which is typically 2 puffs per day. So we're going to add that. Okay. So you can now see these are the prescriptions that you have listed that you want quoted. Okay. Let's add one more drug, just for example here. Let's do metformin, because this is a big one that I see. Let me T-F-O-R-M. Okay, so metformin, as you can see right here, you have a lot of choices, the glipizide, all these different combinations. But let's say that your prescription just has the metformin in it. You need to make sure that you're just hitting the metformin hydrochlorothiazide, which is what is on your bottle if you're just taking the metformin. So let's add that one, and then we're going to add the drug. Now here, this is a very, very important one because a lot of people make this mistake. So you can see there are a lot of options for that drug. Let me show you this. So you have a 500 milligram tablet right here, but you also have a 500 milligram tablet right here. The difference is, see this little ER? That stands for extended release. The extended release is a different cost than the regular 500. So we have to be careful that we mark exactly what's on the bottle because the pricing could be different. Okay, so let's go ahead and let's do the extended release. Now in that case, we're going to do 4 a day, so 120 every month. Add to my drug list. Okay, so in this example, you have all your prescriptions listed here now. We're done adding prescriptions. So let's say all your drugs are taken care of now. We put them in. Now you're going to look at your pharmacy. So let's go in here and let's say that you want to look at Kroger Pharmacy. Let's do Find Pharmacy. And you can see down here, it pops in the Kroger's that's close to your area. Okay. So let's just go ahead and add this Kroger. And then if you want to add another pharmacy, you just go into this box right here. Oops, let's see, we got to add another one. So let's do CVS. For example, Find Pharmacy. And you're going to scroll down here to, let's just add this one. And you'll see now that it's going to compare Kroger Pharmacy to CVS Pharmacy. Okay. Now you're going to scroll over here to where it says done. And now what's going to happen is it's going to start looking at all the plans available. You got to make sure that you're looking at right here. It says you are viewing 2024 plans. You want to make sure this is marked because if not, and it's showing 23 plans, it's definitely inaccurate for you. Okay. So 2024 plans is what you're looking at. So what it shows you down here, let's scroll all the way here to the bottom. You can see all of these plans are available to you. Okay. There's what, 1, 2, 3 pages worth. So what it does is that this program puts this in order, the least expensive for you. Okay. Let me show you what number 1 comes up. So number 1 comes up here, the AARP preferred plan that cost $99.80. This is the number that we look at though, the total drug and premium cost. So when we're doing, like when we look at the review, we look at this number here because yes, the $99 is expensive and is a high monthly premium, but it shows you overall $1,929 is what you're paying. So one may ask, well, hey, I can get a plan for a $0 cost. Let me scroll down here to the one that's a $0 cost for next year. This one, right? I got to find it here. Right here. This one right here is a $0 monthly cost. So one might ask you, well, why can't I go with the $0? Well, look at the overall cost. Okay. So this is where I'm going to get into the mistakes that I see people make. Okay. So you might currently be on, let's just say you're currently on this WellCare plan. Now, one other thing that you have to look for, see what this says is plan ID number 4802-149-0. Because WellCare, in my example, WellCare has 3 different plans. You have to make sure you're looking at the plan that you're currently on. You can't just say, oh, I'm on a WellCare plan. No, what WellCare plan are you on? For example, are you on the one that has the 4802-149 Are you on that plan or are you on another plan? So we have to make sure that we're taking into consideration exactly the right plan when we're comparing. So this is one of the mistakes I see, is that people go compare and they're comparing the wrong plan. So they might say, oh, okay, so as you can see, looking down through here, I'm sure we can see it here in a second, there's another WellCare plan. You just have to make sure you pick your right one, because if you're comparing the wrong plan that you think you're on to the new plan, your numbers are going to be definitely off because it's not going to make sense. So that's one mistake that I see, is you comparing the wrong plan. Now, when you pull out your Medicare prescription drug card, it clearly shows on there the plan name and the plan ID number. It's not your member number. The bottom, I think it's the bottom right-hand side, has this plan ID number, so you know what your plan ID is. So that is one big mistake that I see when you're reviewing your plan. The second mistake that I see is, here's a perfect example. So let's go back to the Symbicort. For example, I know that Symbicort is coming off of WellCare's formulary for 2024. So that means any client that's on this WellCare plan that currently takes Symbicort should have received a letter from WellCare, and starting January 1st, Symbicort is not going to be covered. So that's why you see this big jump up here where it says the total cost is so much more expensive, is because WellCare is deciding to drop that drug. So mistake number two, if you don't do a review, how do you know? Because you could easily miss them a piece of mail that you got from the company, because you're getting all kind of mailers right now, I'm sure. How do you know that your drugs are on the formulary for 2024? So it's very important, because you can see, so if I open this up to plan details, it shows me a breakdown, what the monthly premium, let's go back to the zero, shows me what the deductible is. We'll talk about that in a second. It shows me the preferred pharmacies, but it shows me, let's go to right here, Symbicort. It shows me that drug itself, that drug is what's rising the cost, $4,925.16, which tells me that that drug is not on the formulary. So you have to make sure that your current medications are on the formulary for the next year. That's mistake number two that I see, is you have to make sure that, because if you don't review it, come January, you go to the pharmacy, you go pick up your prescriptions, and pharmacy says, sorry, that drug's not covered for this year. You're kind of stuck with either changing your medication, which I know a lot of people don't like changing medication, totally understandable, or number two, having to pay the full cost, which you can see Symbicort here is almost $5,000 for a 12 months. So that's mistake number two that I see. Mistake number three, let's look through here real quick. As you can see, each plan that you look at, let me go back. Let me just a second here. Let me go back one screen. Okay. So you can see all the different plans. You can see if they have an upfront deductible or not. Okay. Mistake number three that I see is some people will say, well, I'm going to go ahead and enroll in the zero deductible plan because I want a higher, I'll do a higher premium to get the zero deductible. Now, in this situation, this is not a bad idea. However, if you go with the lower premium plans, most all of them have deductibles, but even some of the higher plans. So look at number two here, the Humana Premier plan. That still was $1,900 out of pocket with a $500 deductible. So mistake number three that I see, you received in the mail late, I'd say mid to late September, a packet from your current prescription drug company. It's called an annual notice of change. Now that annual notice of change, the way that that works is it kind of puts it side by side and says, this is what your 23 plans look like. This is what your 24 plans look like. And it tells you what your premiums are changing to, what your deductibles are changing to. A lot of times people forget that their deductible starts back over January 1. So when you're shopping for the plan, you have to look at it and say, okay, remember my deductible, and I've got to remember to budget for that come January 1st. And the deductible changes based on what plan, because as you can see up here, this one did not have a deductible. And the deductible, remember, is the amount the insurance pays before, I'm sorry, but the amount you pay before the insurance kicks in. Now, the deductible does not apply to all drugs on some plans. So here's another one. This one's $545. So see the difference? And what this does is it puts it in order based on the least expensive to you, the least overall expensive to you, the total. So that was mistake number 3 that I see, was the drug deductible. So those are three big things that we look for to make sure that these mistakes are not made. So when you're looking for them, you want to make sure that A, you make sure your prescriptions are on the formulary. B, that your deductible, remember your deductible. Now, one other thing that I want to talk to you about is the preferred pharmacies. Okay, and this is another mistake that I see happen. So you can be on, let me stop sharing this for a second so I can. Okay, so with the preferred pharmacies, let me explain the way that it works. So most all insurance companies on the prescription drugs, they'll say to you, okay, here's a list of all the preferred pharmacies, but if you want to go to these pharmacies, you can go to those. There may be a standard pharmacy or an in-network or out-of-network, but the cheapest amount you're going to pay for your prescription drugs is going through a preferred pharmacy. Now, let me tell you this. Some of these insurance companies for 2024 have changed their preferred pharmacies. So you could always have went to a specific, let's just say you've always went to Kroger's or you've always went to CVS. The insurance companies every year can renegotiate with the pharmacies, and they can agree or disagree to become a preferred pharmacy. So you want to make sure when you're doing the review that you're looking and you're saying, make sure I stay with the preferred pharmacy. Here is an example. I had a client come, we were doing the review, talking him through it. And the way it worked is he was super happy with his current plan, really didn't want to change anything. Everything was going really smooth. And he said, hey, Suzanne, I really don't want the review, but I know we need the review. Let's talk about it. So I kind of talked him into, let's make sure you're good for next year. And what it boiled down to was the pharmacy that he currently went to the next year was coming out of the network as a preferred pharmacy. So him just changing from one pharmacy to the next pharmacy, he did not even have to change insurance companies. He didn't even have to change prescriptions. All he had to do was change from one pharmacy to the next pharmacy. So he was going from one that was going to be a non-preferred to a preferred, and it saved him $1,600. So you can see the $1,600 savings just from going from one pharmacy to the other. So going from a non-preferred to a preferred. That is a big mistake that I see. So you want to make sure that when you're going through this and you look on, you're going through the Medicare.gov, that you're looking to make sure that whatever pharmacy you pick is a preferred pharmacy. So those are the mistakes that I see. Now, as you're doing your review, if you look at the plan and you're comparing what you currently have, remember, be careful to make sure that you're comparing your current plan, because a lot of these insurance companies have multiple plans. Some insurance companies might have 3, 4, 5 plans. You have to make sure it's that right contract number, just like I showed you the contract number. So those are really the 5 mistakes that I see people make during the open enrollment. And I just wanted to make sure that you guys know what to look for when you're doing the review. So just one more thing that I do have to tell you is there's a company out there right now, WellCare, and they're still working with Kroger to make sure that it's an in-network preferred pharmacy. So when you're looking, you got to be careful because it could, they're working on making sure that still is a preferred pharmacy for next year. The other thing is, if you have a Medicare supplement plan, most cases you keep the Medicare supplement plan and you let it renew kind of year in and year out, because as most of you either met with myself or Tisha as your advisor, we told you if you move from one supplement company to another supplement company, you do have to medically qualify. So most clients just kind of let their Medicare supplement run and just kind of roll over. They don't really need to do anything on their Medicare supplement. We typically revisit the Medicare supplement every 4 to 5 years to see if there's something we can do better cost-wise. So really, this is more about the prescription drugs. I just wanted to jump on here, share this with you. Make sure you look for these 5 mistakes. I don't want you to make these mistakes. So it looks like I've covered everything. And if you have any questions, feel free to reach out. Thank you.